Good morning, ma'am.
Okay, can you hear me?
Yes, ma'am.
Okay, so today's topic
Yes,
for
ma'am.
our class. Okay, let's start our class. So today's topic for our class is perinatal asphyxia. Okay, it is perinatal asphyxia because not just birth asphyxia, because asphyxia can occur anytime. So it can occur during delivery and also during in utero before the onset of labor. So that is why the appropriate term is perinatal asphyxia. So before starting this class, you should understand that every baby, in every delivery, there is a potential that the baby can deliver, baby can have birth asphyxia. So for every delivery, a birth personnel should be prepared to manage birth asphyxia. So there should be a trained pediatrician or any trained health personnel who is skilled in neonatal resuscitations. Okay, so we start with this class with this message that in every delivery, all the baby can potentially develop birth asphyxia. So before starting birth asphyxia, we'll just review our definitions. So we know what anoxia is. So anoxia is basically complete lack of oxygen. Hypoxia is decreased availability of oxygen. Hypoxemia is decreased arterial concentration of oxygen. So this is decreased amount of oxygen in blood. And ischemia is insufficient blood flow to organ, resulting in interrupted metabolism and ultimately death of the cell or organ affected. So you should know the difference between these four terminology. So what is perinatal asphyxia? So perinatal asphyxia is a hypoxic insult to the fetus, severe enough to cause metabolic acidosis, neonatal encephalopathy, and multi-organ system dysfunction. So it is a hypoxic insult to the baby, to the fetus at the time of delivery or before delivery, even in utero. And it causes metabolic acidosis, neonatal encephalopathy, and also multi-organ system dysfunction. So this is the definition of perinatal asphyxia. To simplify this, Neonatal Forum has defined asphyxia as gasping or ineffective breathing or lack of breathing at first minute of life. Okay, this is a simple definition. So gasping or ineffective breathing or lack of breathing at 1 minute of life. If a baby, when the baby is delivered, is not breathing or is having gasp or is not breathing properly, then this is termed as birth asphyxia. And for definite diagnosis, a definite definition, it is a hypoxic insult to the fetus, severe enough to cause metabolic acidosis, neonatal encephalopathy, and multi-organ system dysfunction. Clear with the definition? Hello?
Yes,
Definition?
ma'am.
Okay. Now, before we go on to another definition, we should know.
Ma'am, fetus भनेको इन युटेरोको कुरा मात्र भयो कि म्याम बाहिरको पनि कुरा भयो म्याम?
Fetus भनेको इन युटेरोको कुरा हो, डेलिभरी भएपछि इट्स अ बेबी. Okay?
Ma'am, definitionमा fetus मात्र भयो.
No, it doesn't matter, Baba. Hypoxic insult to the fetus. Delivery हुनु अगाडि बच्चा डेलिभरी भइसकेपछि birth asphyxia हैन, डेलिभरी हुने टाइममा लेबरमा र inside the baby, inside the mother's uterus, दुईटै टाइममा asphyxia हुन सक्छ. That is why we don't call it birth asphyxia. We call it perinatal asphyxia. So you can say it's a hypoxic insult to the fetus and the newborn. Okay? So this is during the time of delivery as well as during the inside the utero. That is why the fetus term comes, because this is not when the baby is just when baby is delivered. It is also during the utero. During the before the onset of labor mane, if momiko cord compression भयो, placenta abruptio placenta भयो भने जन्मिनै पर्दैन, जन्मिनु अगाडि नै asphyxia हुन सक्छ. Okay, that is why fetus is here. Clear?
Yes, ma'am.
Okay. So before we start with perinatal asphyxia, you should know about APGAR scoring. Okay, so APGAR scoring is the scoring system that we give to the baby immediately after they are born. 1 minute of life or 5 minutes of life, we give this scoring. Okay, so APGAR scoring is a scoring given to the baby after birth, at 1 minute of life, and after 5 minutes of life. This is a very important score because this will predict birth asphyxia and also will predict the neurocognitive outcome of the baby. Okay, this is a very simple score. Apgar vaneko A, P, G, A, and R. Okay. So we have, just a minute. So we have A, P, G, A, and R. A is activity. So if the activity is absent, 0 point. Activity arm and legs are flexed by 1 point. If the child is having active movement immediately after delivery, that is 2 points. Pulse, if it's absent, 0 point. Less than 100 beats per minute, 1 point. More than 100 beats per minute, 2 points. Grimace, okay? If you put a nasal catheter or suction catheter गर्दाखेरि बच्चाले मुखहरु बिगार्यो या मुभमेन्टहरु गर्यो भने that is grimace. So if there is baby is completely flaccid, there is no movement by 0 point. If there is some flexion of extremities, we give 1 point. And if the baby is very active with sneezing, coughing, pulling away from the suction catheter, then we give 2 points. Now for appearance, if the baby is completely blue or very, very pale, 0 point. If the body is pink and extremities are blue, we give 1 point. If the baby is completely pink, we give 2 points. Okay. In case of respiration, if the respiration is spontaneous respiration is absent, we give 0 point. If it is slow, irregular, we give 1 point. If the baby is crying vigorously, that means the baby has good respiration. So we give 2 points. So we give this score in first minute of life, and again we give it in 5 minutes of life. So Apgar score always contains 2 scores, one at 1 minute of life and another at 5 minutes of life. If the Apgar score is very low, 0 to 3, that means the child is severely depressed. That is, there is severe birth asphyxia. If the Apgar score is 4 to 6, there may be moderate asphyxia. And if the Apgar score is 7 and 10, then there is no asphyxia. The baby is in excellent condition. This is how we determine whether the baby requires further resuscitation or not. And we also can predict neurocognitive outcome on basis of the Apgar score. So this score is very, very important. You have to give this score to each and every newborn that is delivered. Now, then, again, we have AAP criteria to diagnose birth asphyxia. So birth asphyxia, NNF classification, if the baby is not breathing, or if the baby is having gasp, irregular breathing in the first minute of life, then we term it as birth asphyxia or perinatal asphyxia. But there are some criteria where when we diagnose perinatal asphyxia, these criteria needs to be fulfilled, any of these criteria, okay? So according to American Academy of Pediatrics, if the umbilical artery blood pH, when we do arterial blood gas analysis from the umbilical artery, if the pH is less than 7, if the 5-minute Apgar score is less than 3, and if the child has developed neonatal encephalopathy, like in case of seizure, hypotonia, or coma, immediately in the neonatal period, or if there is evidence of multi-organ dysfunction, then we can categorize the baby as having perinatal asphyxia. Okay. So even if you don't remember these, just remember the 5-minute Apgar score. 5-minute Apgar score less than 3, and neonatal encephalopathy manifesting as seizures. Okay, so why is birth asphyxia important? So if you see in this pie chart, you see the first cause of mortality in a newborn is, number 1 is preterm. And the second cause is 22.4% is birth asphyxia. Then after it is infection. So birth asphyxia plays a very important role in neonatal mortality and also in long-term morbidity. Okay, so birth asphyxia is very important. So prevention of birth asphyxia prevents a lot of neonatal mortalities and morbidities. Now, what is the physiology of asphyxia? What happens when the baby is asphyxiated? So when the baby is asphyxiated, either in utero or after delivery, this part is very important. Okay, we generally tend to think that the birth asphyxia occur during labor. It is not so. Birth asphyxia can occur in utero itself. So you have to have a careful monitoring of the baby in the utero itself. The final stage of the labor, before the onset of labor mane CTG garera, fetal heart sound sunera, proper monitoring गर्नुपर्छ. Because asphyxia, most of the time asphyxia is antepartum. Okay, intrapartum pani huncha, antepartum pani huncha. But most of the time it is antepartum. So this part you have to remember. So when the babies become asphyxiated, they undergo a sequence of the events. Okay, so there is two sequence of event. It is known as primary apnea and secondary apnea. Now, what happens in primary apnea? So asphyxia भयो, for example, abruptio placenta भयो. Abruptio placenta ma baby le